This is a shout out to Hungry Fat Chick. Hey, Candy, it's your boy Pop Pop. I'm glad that you're out of the hospital and back home and all of that, but you know, I gotta tell you some things, and it's too much to put in the comments section of your video. You know, you you got back home, and the first thing you do is eating fried food and washing it down with an enormous amount of sugary, drinks, lemonade or iced tea or whatever, and you got two of them. Both of them were 32 ounces, it looked like. You're right back to that path of destruction that you're on. And you're showing all of your wounds and everything, saying that your veins blew out as they were trying to uh, uh, put the lines in and everything. And that's because you're not doing any exercise. Your venous system is petite. It's not built up. And pardon my saying so, but the whole time you're stuffing your face, you're complaining that you weren't treated properly, that you had to wait too long, before they got you a room. Well, a hospital just doesn't kick one person out because another person comes. They have to make an arrangement in order to get you a bed. It's not like a hotel where there are reservations and they know what they have. When somebody comes in, somebody like yourself who has mistreated your body time and time again, and then all of a sudden you have to come to the hospital in an emergency situation, then they have to accommodate you. And you said you didn't like the bariatric bed. Candy, I used to work in nursing. Bariatric is just a nice word for obese. And there are a number of reasons they had to have you in a bariatric bed. A bariatric bed is for people who are very bad off. So you were much more ill than you have in your mind. They very probably saved your life. The other thing is a bariatric bed has a scale at the end of it. So they have to know your weight so that they can properly medicate you. And you say you're just getting pumped full of all of these antibiotics and all of that other stuff, which is killing the good bacteria in your gut. So that's going to be a problem in the future for you. But in any case, as I said, I worked in nursing, and to move an obese person, I mean, people like myself would go home and your back hurts and everything because you're moving patients all day. It's not an easy job, and it's not a well-paying job, I can tell you. And so a bariatric bed inflates and deflates on each side in order to turn the patient and keep their circulation going and keep their hip bones from compressing the mattress, because if you're in a regular bed and your hip bones compress the skin as your body crushes that mattress, then you get what's called die-off of cells, and those cells die off and you get these huge spots of dead cells, and they turn into bed sores. And that can also turn into a blood clot. So as you're complaining that you don't know why they gave you a bariatric bed, and next time you're going to tell them, you're just going to risk your life even more. And you said that You said that you were getting up every 2 hours to pee. Did anyone give you a glucose tolerance test? Because it sounds like at the very least you're pre-diabetic. If you're having to get up at 2 o'clock, two hours to piddle, you could be pre-diabetic. You could have a urinary tract infection on top of the other infection that you have, you know, and you were short of breath in the hospital. I didn't see that they had given you oxygen. I mean, what was your oxygen content? That's another thing you should know. Your pulse ox reading. And I saw the food that they gave you was kind of cringeworthy. My hospital in Laurel, Maryland has top tier food. Last time I was there, they had this marvelous chicken and rice pilaf, and everything was very top tier and tasty. I mean, the only bad thing about the hospital was that everybody was fighting. The nurse staff was fighting with each other. You know, they were all from the islands, and the head nurse was fighting with the other nurses, and they were talking Nigerian or something. They were arguing. It was terrible listening to the nurse staff fight with each other. But in any case, Candy, if you were scheduled for 10 days in the hospital, you were a lot sicker than you think. And you got out after a week. You got out early. And they probably did that as an accommodation because you started to complain about everything. So all you're doing is you're putting your life at risk. And you don't have a grasp on how much danger you were in and how much danger you are in as you're you're not moving around. You're just sitting in that chair at home, eating yourself to death. I mean, you said you were down to 430 pounds or something. Well, a woman your size should weigh 130 pounds. So that means you're 300 pounds overweight, Candy. A woman your size should weigh no more than 130 to 160 pounds at the most. And you weigh 430, whatever, and you were proud of yourself. And you said that you never had a problem carrying your weight with your bowels around to your knees, past your knees. And in your mind, that's normal. And then you mentioned that Nick Avocado, gave you healthcare advice. You and Nick Avocado, when you get on your threads and tell people it's okay to eat, 4 boxes of donuts and stuff, you're doing a terrible disservice. And you say that you see these globes from time to time. Those globes that you see floating around is probably something like a transient ischemic attack where your blood pressure is through the roof. It's probably not anything to do with, witchcraft or that other stuff, that goth stuff that you're involved in, which, by the way, puts your soul in jeopardy. You really need professional help tied in with your medical situation. You ought to get the transcript from the hospital while everything is still fresh. And you ought to get with another doctor who can go over your liver function, kidney function, what your glucose was, what your blood pressure was trending at, And you just blithely say you know everything about everything, and you're an old woman who's 50. 50 is not old at all, Candy. most women live at least into their 70s. So you stand to throw away 20 years of life, and you also have gotten yourself into a position where you can't go anywhere. You say you're agoraphobic. Okay, but that's complicated by your weight. And you live in one of the most exciting cities in the world. Candy. Think about all of the experiences that you're missing out on. And everything in your mind is food. If I had $1 for every time that you've said food, I'd be a rich man. You know, everything is food, food, food. And that goes back to some sort of trauma where in your mind you were worried that there wouldn't be enough food. Obese people always survey the amount of food. Nick does it too. He looks, while you're doing a video, you look out over your food and you survey it and you worry that there's not going to be enough. I mean, I've watched your videos for a long time. And you always look out over your food and you survey it. Then whatever condiments they give you, that you use the maximum amount of condiments, salt and ketchup and all of this other crap that's no good for you. And you eat huge portions. You know yourself, you say you have a spirit of gluttony. Well, gluttony is a sin because, especially in this day and age, where half the world is starving, we have starving people in America now. We have starving people in America. I myself have to portion control my food. Yesterday, I ate half a baked potato, chopped up with a little bit of cheese on it, and a cup of coffee was my main meal. Or I'll have a little quarter cup of rice with some beans. I have to be very careful about portion controlling my food because my channel's not monetized. I don't get any income from my channel, and I have to live off fixed income. I don't monetize my channel because I don't want the hassle from having to declare it on taxes. And for a lot of people who are getting paid on the tube and aren't declaring it, Uncle Joe says he's coming after those people, by the way. Anybody who's earned more than $600 on the tube, you're going to get what's called a 1099 modified, where you're going to have to declare that stuff and pay taxes on it. So if you're not doing that, you got a surprise coming too, because they can cut that income off. But in any case, you have all of this stuff. You have all of this stuff going on, and you don't have a right. You don't have a right mindset about what you're doing to yourself. You could have a stroke where you could have to live, paralyzed on one side for 20 years, like your friend Hungry Hippie, whatever his name was, Thomas. He did that video where he ate all of that ramen noodle soup, all that salty ramen, and then he had a stroke. And now he's got to live with that as a young person. He's got to live a very long time with that. But Candy, you need professional help at this point. You need something like a Dr. Now or whatever his name is, situation where you have somebody who takes all of those panels that they ran on you in the hospital, the blood tests and the urine tests and all of that other stuff, and you need to get with a doctor who will interpret that, lay out a course of action and a diet plan, and you always intimate that your fans are not going to watch your channel if you don't eat this horrendous amount of food. Nothing could be further from the truth. We're always happy to sit and watch you, even if you ate a salad and told a little story, and did candy light. You wouldn't lose any subs at all, I can tell you. But in any case, like I said, you immediately come home and you hop right back onto that train of destruction. No greens or anything. You could easily get one of those machines that grinds the carrots and the apples and the celery into a smoothie. They're very pleasant to drink. They're a pain in the ass to clean up. I've got a couple of them myself. And as a handicapped, bedridden, wheelchair-bound person, it hurts for me to sit in the wheelchair and fix myself something. So if I'm really concerned about not having had enough veggies, at the very least, I open up the refrigerator and I'll get a piece of celery and eat it, or I'll get a carrot, when I'm eating something else. But see, you're saying the next time you go in, you're going to tell them not to give you a bariatric bed, and you're going to tell them this, and you're going to tell them that, and you're going to set them right. You're just going to increase the chances of mortality. You're just going to increase the chance of getting a blood clot or something like that. And Candy, in the back of your mind, you said that, like I said, you said that you used to have no problem at all carrying the weight, and it's just sciatica. Your body is breaking down. Your body is like you're driving a Volkswagen and somebody put a dump truck chassis on that body and started to fill it with rocks. That's why you have sciatica and all of this other stuff, is because you're sedentary and those hip bones are pressing on the meat, pressing on the chair, cutting off circulation. And the cells that aren't getting enough nutrients and oxygen deep inside your body are beginning to die off. Your body's telling you that you can't stand much more of this lifestyle. People are trying to reason with you lovingly. And then you show your cup of blood for your enemies or whatever, where you hope people that have said something to you, that something bad happens to them. I mean, it's almost not worth trying to reason with you, Candy. It's almost not worth it to put myself in the situation of dealing with your ire. But again, lovingly, I'm trying to tell you that at the very least, give up all of that watching horror movies and that goth stuff. Ask Jesus to rescue you from that spirit of gluttony, which you yourself have admitted to. I myself have got a very bad background of idolatry. I was raised with idolatry, verbal and physical abuse, and incest from my sister, who hit on me when I was 17 years old, getting raped, thrown out onto the street at 15 years old with the clothes on my back. All kinds of stuff happening to me, living among drug addicts and prostitutes and stuff like that. I went to my mother's funeral with a prostitute, very pretty lady, but she didn't have anything to do with me. She was just eye candy, and a shoulder to cry on. But that was my circle of influence and I kept myself free of drugs. I watched after my health. I was a runner on a recycle truck. And then I got run down by the truck, flattened like a squirrel in the street. And then as I was recovering, a young undocumented immigrant who didn't like the looks of me came up behind me and punched me in the spine. And that was the last time that I walked. And I've been bedridden ever since, having to wear a diaper like a 2-year-old baby. You know, I didn't do anything to the man. The man said he was triggered by my looks. I'm telling that to you, Candy, to say that everybody has rough times. Everybody. And at times you act like you're the only one who's had rough times. And you were loved. You said that as hard as you were on your grandparents, that they loved on you. So that even proves their love even more that they had for you. And someday, if you accept Jesus into your heart and you go to heaven and you see them, you know, all of this will be just in the past for you. You'll forget about it and you'll have a beautiful eternity. But that business of dealing with the witchcraft and the goth stuff and the overeating and all of this other mess, that's taking you in the wrong direction, Candy. I'm telling you as lovingly as I can. I'm telling you as a true friend. It boggles my mind why you think somebody like Nick Avocado, who's enabling your destruction, is your true friend. That boggles my mind. But if that's the way you want it, Candy, that's the way you're going to have it. God Almighty doesn't interfere with people. He gave us freedom of choice, but he also gives us the Holy Spirit of God to help us discipline ourselves if you want. If you're not disciplined, you're the same as a dog going at the pan. A dog, if you give it too much food, will eat and eat until it throws up. And then an hour or two later, it'll go back to the throw up and it'll eat that. So God gave us humanity and discipline and all of that other stuff because we're better than animals. But like I said, if you just go at the trough and you act like you're a dog at the pan, eating as much as you can stuff in your face, especially since people in this country are starving, then that is a spirit of gluttony. And it is a sin. God says gluttony is a sin for that reason. So, again, Candy, I'm telling you as lovingly as I can, and it's too much to put in your comments section, but those people at the hospital did right by you, putting you in a bariatric bed, even though it was inconvenient for you. It's inconvenient for you because you're a very short-statured lady who's carrying 300 pounds too much weight. 300 pounds would be like carrying 2 more women. If you had another woman who weighed 150 pounds on one side and another woman who weighed 150 pounds on the other side, just think about it. That's what you're dragging around every time you try and get up. It's like you're trying to get up with 2 other people holding you down. But Candy, you need a reality check. You know, like I said, you got your bowels all the way down at your knees. And that's not normal. That is not a normal lifestyle. And at this point, if you're going to make it, you need professional help. Pop out.